Well, over the last 10 years, new drug classes have been developed, and we now have products in all of the innovative classes of oral medications for type 2 diabetes. And so now what's happening is we at AstraZeneca, together with healthcare providers in the US, are really learning how to use these new drugs in combination, to use them earlier in therapy, and ultimately to make a difference for patients, or people living with type 2 diabetes. We have products in all of the innovative categories. The SGLT2 inhibitors have gotten a lot of attention over the last couple of years, and we've got 2 studies here this year showing that they can be used in combination with existing oral antidiabetics and can improve outcomes for patients. SGLT2 inhibitors in the kidney, there are SGLT2 transporters, which normally would reabsorb glucose. The SGLT2 inhibitors block that reabsorption, and so the excess glucose, the excess sugar, comes out in the urine and lowers the blood sugar as a result, which is exactly what you're trying to do for people with type 2 diabetes. They've been shown to be quite effective in a broad range of populations of adults with type 2 diabetes, across ethnic groups, across age groups, males and females. And so we're very excited. The product was launched last year, so this is our second year with this product, dapagliflozin, which is known as Farxiga here in the United States. One of the studies that we presented here shows evidence that when dapagliflozin is added on to a background of patients already being treated with saxagliptin and metformin, that there's additional benefit in lowering of A1C when compared to placebo, as well as the proportion of patients who reach their target goal of a hemoglobin A1C of less than 7, as well as reductions in weight, fasting plasma glucose, postprandial glucose as well. So it looks like this combination of approach can make a difference for patients. There were no additional safety concerns beyond what we had already identified and understood from our clinical development program. All drugs have both risks as well as benefits, and so does dapagliflozin. One of the most common adverse events that was seen in our clinical development program was genital infections, which we also saw in this study as well. Fortunately, that's an adverse event that can be identified and treated.